Jay, please. All right. I mean, I know it's Friday and everything, but come on. Sure. Such a delay here. All right, very good. Good morning. Happy Friday to everyone. As always, I want to thank Jay for being here to interpret. We do have the health commissioner with us today, Greg Kesterman, and he obviously has the numbers, as he does every day. I'm going to start with the numbers, though, as we always do, and then he's going to elaborate on the numbers, what they mean, and he's going to talk about the stay-at-home order as it stands at this moment in time. So what's been continuing to be restricted and what's not. So the numbers, as of this morning, and remember, the numbers are going to seem a little different today because we didn't have a briefing on Wednesday, and so I just want people to remember that. So they're going to be a little bit higher than they were because we were doing them every 2 days. So the number of positive cases in Hamilton County is 1,218. Those who are hospitalized is 267, and deaths have climbed to 71. And as I said, we're going to hear shortly from Greg Kesterman related to all of those. But before we do that, I've got a number of announcements. You know, this is what happens when you skip a briefing in the middle of the week. A lot has happened since Monday, and so we're going to do some quick updates. First off, we'd like to thank Kroger, I think I've mentioned this before, for continuing their contributions to the community during the crisis. Their latest contribution is to offer drive-through COVID-19 testing in Hamilton County for eligible patients both yesterday and today. Healthcare workers are expected to administer 250 tests a day at the site, which will be open from 10 to 4 at the Dunham Recreation Center today it's really in West Price Hill, Westwood. It's over on the west side. You have to register online in advance. Those interested in registering to see if they are eligible should visit www.thelittleclinic.com/drive-through-testing to register for the test. The test is free of charge for those who are eligible. You do have to be eligible in order to be tested. People who need a test will use a viral screening tool provided by the Centers for Disease Control to see if they are eligible. Patients eligible for the testing are based on CDC guidelines, state and local government recommendations. Patients eligible for a test will complete pre-appointment paperwork. When a patient arrives for a test, they should have a photo ID ready and keep all windows rolled up until instructed otherwise. The test consists of a self-administered nasal swab, which is ordered and observed by a medical provider. This method of testing limits the use of PPE. Test results are expected within 48 hours. So as you can see, where this was announced, the city announced this. I think the mayor announced this at one of his briefings. And so we were contacted by Kroger. The anticipation is that they'll do maybe once of these per week at a different site throughout the county. So the Dunham site is the first, and they will expand now into other parts of the county. So more to come on that. I know that there has not been a site determined for next week, but as we get that information, we will happily pass that along. And thank you again to Kroger for offering that testing. Next up, good news for golfers. We've gotten a lot of questions from golfers. Great Parks of Hamilton County will reopen all 6 of its golf courses today, but it will come with restrictions. I also put a call in to Daniel Betts, who is the director of the Cincinnati Recreation Commission. The Recreation Commission also has a number of golf courses throughout really the city and the county, and they are also opening up today and tomorrow what he describes as a soft opening. So there are some restrictions. So for those of you, it's supposed to be beautiful tomorrow. So for those of you that intend to go golfing, here's what you should anticipate. Tee times must be reserved in advance online. For Great Parks courses, you go to greatparks.org/golf or simply call the golf course directly. Riding carts are single passenger only on a limited basis. Driving ranges putting greens, and snack bars will remain closed. Okay, I've been asked for that update at least once a week. Next, and Greg's going to expound on this, we had an employee of a juvenile court facility test positive for COVID-19. Thanks to Judge John Williams, he had a briefing yesterday related to this. The JV court is taking precautions and public health is responding. So Greg will provide more details during this briefing related to what is happening over at JV court. On another matter related to county buildings, starting today, everyone entering the courthouse will be required to wear a mask. Other county buildings remain closed, but we are putting together plans to reopen those buildings, and we're going to talk more about that on Monday. Jeff Aludo will be here Monday, and we're going to talk about how the county plans to open up as the rest of the community starts to open up. So again, Judge Kubicki has been in touch, wanted to make sure that everybody realizes you have to wear a mask in the courthouse as of today. Next, we are going to thank Delhi Township trustee Rose Sturs and her sewing group for making masks for JFS caseworkers. Their next project, and do we have a photo? Is there a photo of this? Very good. I believe it's up. So you can see they're wonderful. They're colorful. Hold on. I have one. I have one. I took one out of the stash. There it is. So we had about 100 of these delivered. I actually went to Rose's house and picked them up on the porch. We delivered them to JFS. So thank you to Rose and the sewers in the group. We have asked Rose if they could modify this size into child size for the kids in foster care in our community, and the answer was an enthusiastic yes. And so they are now sewing child size masks for the kids in foster care, recognizing that as we open up, these kids travel to appointments, they travel to see their biological parents, they do a lot of visits, and so they also need to be protected. So thank you to Rose. I will be happy to pick those up over on your doorstep whenever they're ready. But I just really a big shout out to her to double win when we open up, because foster kids and our employees will be safe. Next, I want to mention that I visited the county's warehouse and distribution site for PPE earlier this week. Big thanks to Nick Crosley for all the work he's doing in bringing in the supplies and then distributing out the supplies. While I was there, coincidentally, the post office was dropping off donated masks. There were 4,000 N95 masks being dropped off by the post office. Remember, the post office had N95s because of the anthrax scare a number of years ago, and so they are now repurposing those masks. So big thank you to the Postal Service. While there, Mount Healthy Fire Department was picking up some masks for their EMS. So you can see what a great collective effort this is. Also, the state stockpile released 40,000 N95s to Hamilton County. Those were on the skids when we were there, getting ready to be pushed out to the hospitals. Remember, the N95s are the best, top of the chain masks, and so they are going to the hospital employees. So 40,000 were distributed to the hospitals in Hamilton County. That is great news for the hospitals in Hamilton County. And thanks again, so not only to Nick, his team, but there is a private business owner that is donating warehouse space for this distribution. He is taking his own time to bring those skids in, bring the supplies in, so big shout out to him. Really appreciate that. All right, I think we covered all that. Another item of note, some of the county employees who were previously furloughed will be temporarily redeployed to public health. We need more contact tracers as we get back out and we have more testing available. And so as people identify as positive, we need individuals of public health to trace those individuals to see who they've interacted with. So we are redeploying employees as we can. In Hamilton County, the cost of that we anticipate will be picked up by the federal dollars. This is one creative way of using some of the federal dollars that are restricted. We've talked about that. And so I'm happy to say a number of employees, even on the 6th floor here at Hamilton County, are going to be redeployed to be contact tracers. They will be trained, and I think at work on Monday. And my administrative assistant, Fatima is one of those people. So thank you to Fatima. She's willing to be part of the answer to the question, how can we help? And so thank you to her, and thank you to the others that have been willing to be redeployed. Next, a quick recap on yesterday's board meeting. Commissioners voted on a $21.6 million cut package to our budget. Remember, the hole's about $40 million or so. We're about halfway there with these cuts, and we've delineated some of these in the past. We also appropriated the $142 million coming in from the federal government through the CARES Act. This is the restricted funding we've been talking about. So that has hit the bank account. We are trying to figure out how we can utilize those dollars. We do not want to leave dollars on the table. And so we've already talked about some of the PPE, the rehousing efforts, the 911 efforts to separate 911 staff as they continue to take calls. We're now ramping up our redeployment. So these are some of the ways we're doing this. Again, Jeff Aluto will be here on Monday. We have more information related to that, but I feel like I want to get Greg up here, honestly. So we'll talk more about those details on Monday. Thank you also to the county employees for kind of bearing the brunt of the sales tax decrease that we know we're going to see. Many people are furloughed, and it's been a real adjustment. And so thank you all for helping with the effort, and we hope to have everyone back as soon as possible. Also, along these lines, we also had a number of items on our agenda yesterday related to the Bengals and the Reds stadiums. That fund also is going to see a hit because of the sales tax decrease in revenue, about the same percentage. And so we worked with the Bengals and the Reds to take some of those items off the agenda. We all agreed now is not the time to move forward with some of these capital projects. We're doing the things that we know are important, concrete repair and waterproofing, to make sure we don't have to spend more later because we didn't do what we know we need to do now. But some of the other items were postponed. So thank you so much to the Reds and to the Bengals for being our partners as we proceed through this crisis. And then finally, and I mentioned this, the 911, I think we have a photo of this too. The 911, remember, good. We have folks working in 911. They haven't stopped working 24/7, but we needed to spread them out because they work really close to one another. And so we were able to purchase additional equipment. This was already in the works, but we used the federal dollars for this. And so they're able to spread out. And there is another site that now has been opened to allow for that work to continue in a safe way. Thanks to Andy Knapp for his help with that. All right, Greg, I think we're ready to go. So Greg is going to talk about some updates related to the numbers. I want to give one caveat. So you may have noted, and this is what we're going to see, is that the positive case trends are moving up because the testing capacity is moving up. Right? So we're going to continue to see that positive number move up. And that's important to note. The hospitalizations and especially the death numbers are indicators of how we are doing in the community. And so Greg will expound on that, but I do want to note that it's important to kind of distinguish and understand what's happening broadly related to the numbers that we talk about every time we do a briefing. So with that, Greg Kesterman, Interim Commissioner of Public Health. Hamilton.
Thank you, Commissioner. I will start with the state of Ohio numbers. In Ohio, yesterday at 2 p.m., the state reported 18,027 cases of COVID-19 with 30,533 hospitalizations and 898 deaths. As Commissioner Dreihaus just shared, here in Hamilton County, we have 1,218 cases of COVID-19, as well as 267 hospitalizations and 71 deaths. We know that Ohio is getting ready to do some major ramp up in testing. The governor indicated we'll be in the tens of thousands of tests per day by the end of the month. This is fantastic news because we'll be able to start testing folks that are mild to moderate symptoms. Those individuals previously have not been able to be tested. Where that is extremely helpful is my team of epidemiologists and disease prevention specialists that we've talked about are able to do contact tracing on those folks that are testing positive with mild symptoms. We're able to quickly isolate those individuals and keep them out of public as we start to open things back up. As Commissioner Dreihaus just shared, we're happy about the collaboration and partnership with the county specific to contact tracing. We know we're going to have a lot more work, and so the more help we have, the better we'll be able to manage this workload, and the better we'll be able to make sure that my team isn't working 60, 70-hour weeks, which is definitely a great thing. My team's been working very hard to do great things here in Hamilton County. We know the governor on Monday started to announce the opening backup plan. So far, we're just into phase 1 of the plan. The governor and Dr. Acton talked about Responsible Restart Ohio. And what we're really trying to do is open things back up correctly so we don't see a spike in those hospitalizations and deaths. We're going to, as Director Acton said, turn things back on like a light switch. So go slow with it and take very planned steps to make sure that we keep spikes down. So today, May 1st, we know that all medically necessary procedures are allowed to begin. In addition, we know that dental procedures and dental visits, even just routine checkups, are allowed, as well as veterinarian services. So that's kind of the first phase of the reopening. Beginning on Monday, May 4th, we are now going to allow for any manufacturing, distribution, or construction that was canceled as a result of the stay-at-home order. Those items are allowed to begin. I know many of those have continued if they were deemed crucial, but those that were not initially deemed crucial or essential are allowed to start back up. So that's on Monday. We then get to May 12th, and this is where consumer, retail, and service businesses may begin to reopen. So we've had a lot of questions about this particular one because this impacts so many people. We know in the retail setting, all types of shops will now be allowed to get going again, as well as service businesses. Services would include photography, dog groomers, and any types of those special services. I have a slide that I'd like to share showing some requirements for all businesses as we start to get things back open. We know that face masks are now going to be required for employees. They are not going to be required as originally thought for anyone visiting a store, although they are strongly recommended. I'll take a moment to just remind everyone that face masks, particularly the cloth face masks, do a really good job if you cough or sneeze and you're not showing any symptoms. You keep your germs to yourself and prevent others from getting sick. The second item there in the list for businesses that are getting back open, there's a requirement that they do daily health assessments for their employees. The employee is allowed to self-take their temperature at home and report it to the business, but it is an expectation that businesses are checking in to make sure their employees are safe. Obviously, hand hygiene is something we've been talking about since January when we started talking COVID-19. We need people to continue to wash hands and making sure that they're doing that frequently to help reduce the spread of germs. In addition, if you're coughing and things of that nature, we want you to do the hygiene cough into the crux of your arm. And then lastly, there's an expectation that businesses clean and sanitize high-touch surfaces often. Lastly, in cases of retail business where a lot of folks can congregate, there is a requirement to limit the capacity of those locations by 50% of the fire code. So they're really just trying to reduce the number of people in stores and to give more people space when you're out recreating or doing shopping and things of that nature. If you want to see more details on this, feel free to go to coronavirus.ohio.gov. The new order just came out late last evening, and it does have more specific details for businesses. There's specific fact sheets that can help you as you're trying to open your business up. We do know that there are several things that are going to remain closed, at least in phase 1, although the director has indicated that there are now task forces being formed to try and get some of these businesses open as quickly as possible as well. The first one that I've had a lot of questions about is restaurants. We know that restaurants are able to do carry-out service. They are very anxious to get people back inside of the restaurant. So there is a task force being formed by the governor and director of health to figure out ways to do that safely. But at this time, as far as dine-in service, that is still closed. We saw that schools and daycares are still closed, and I know that's an impact as people are getting back up and working, but that is still listed in the director's order, as well as personal appearance and beauty salons. Many of us, including myself, I'm very much ready for a haircut, but that is not yet permitted. And lastly, entertainment, recreation, and gym facilities are still closed at this time. They are also, I believe, having a task force with the governor to figure out ways to get these businesses up and going as well. Just to finish up here, I did yesterday attend a press conference over at juvenile court with Judge Williams, and they did have one employee test positive. I was very impressed with juvenile court. Throughout this whole pandemic, actually, they've taken many very proactive steps, including early on requiring every employee coming into the building to get a temperature check. That process has actually prevented people from coming into the building that shouldn't be inside. So as soon as they found out they had an employee that tested positive, they contacted Hamilton County Public Health. As you know, our role in this is the contact tracing. So our team actually in this case was fortunate. In a juvenile court, they have a lot of video cameras to monitor folks and movement inside the building. So they were able to utilize their video cameras to help us understand who would be considered a close contact, who was in within 6 feet of that employee. Luckily, this employee was working the night shift, so it really actually only impacted 3 additional employees. Those employees have been isolated for 14 days and are not allowed back at work as well. Our team also then did some additional contact tracing outside of work and figured out who else needed to be isolated. Lastly, in closing, I'll just reiterate as we start to open things back up, let's do a good job of this so that we can get it right on the first time. Ohio's had a lot of compliments, and I think the work we have done here in Hamilton County should go noticed because we worked hard as a county and we made this pandemic less impactful here as well. So thank you, and with that, I'll turn it back to Commissioner Dreihaus.
Thank you, Greg. Bridget, I'm sure we have questions for Greg, but I'm going to start with a question. I got a call yesterday from my friend Steve Beltos. He is the owner of Price Hill Chili. Greg and I have both been there many times. I've been there many, many times. I used to live right down the street. And he had a question. And so I said, wait a minute, I've got the health commissioner at briefing tomorrow. Let me ask this question because I think a lot of people probably have the same question, both as business owners, but also as patrons of many, many of the really popular restaurants throughout our area. And so here is the question from Steve Beltos. County Commissioner, I would like to know if it is possible to put picnic tables in my parking lot for people to use on their own with social distancing, of course. Thank you for your time. And so I think the implication here, I want you to maybe answer this both ways. One is, does a business owner have the option of doing the social distancing with tables outside? And also, if someone were to come in, as many of us are doing right now, order carry out, and then maybe there's a table in the parking lot, and is that allowed? I think, we're trying to think of creative ways to do this. So your response to that, please.
Thank you, Commissioner. And unfortunately, at this time, restaurants are still closed, and the order from the director is very clear that that includes outdoor eating areas. I think the proposal being put forward by Price Hill Chili is absolutely a very reasonable one, and I recommend every restaurant take the time to reach out to your restaurant association. So as Ohio is forming the process for getting restaurants back open, your ideas are heard. I think the suggestion of sitting outside and social distancing outside is absolutely a great start to getting restaurants back open. So we look forward to working with the state to get some of these things started here in Hamilton County as well.
Thank you. That may not have been the response that you wanted, Steve, but that is the response. More to come on that. I'm going to add one caveat. My mom told me that I have an aunt, Aunt Pat, who goes to Price Hill Chili a lot with her friends. And so really was missing going. And according to my mom, she and her friends carry out at Price Hill Chili, get in their cars in the parking lot and talk to each other on the phone while they're eating their Price Hill Chili. So that's one way to get to it, right, Greg? That's okay. A little deviation on what the question was, but Aunt Pat, hats off. I mean, very creative way to address the social distancing issue. So with that, Bridget, I think we're ready to go to questions from the press.
Thanks, Commissioner. Our first question comes from Jay Hanselman with WVXU.
Yeah, if I could, I had 3 quick questions for Greg. The first one, we received a release this morning about UC's COVID-19 projections creates a roadmap to reopen Ohio. Are you familiar with that analysis, and do you have any response to it?
I am not familiar with that specific analysis. My team, including myself, have worked a lot with UC, and they are showing the disease transmission here in Hamilton County. I suspect that's what it is, but I'd hate to talk to it without reading specifically what you're referring to.
Okay, fair enough. When you were talking about the 5 protocols for all businesses to follow when they reopen, if an employee is working for an employer who is not following those 5 protocols, what can they do about it?
I would recommend you visit our website, hcph.org, and for the jurisdiction in which we serve, we are going to do follow-up with any of those businesses. You can use any of the forms. There's a complaint form on that website. I would recommend folks follow that as a way to get that out. If it is not within our jurisdiction, we get these kinds of complaints all the time, and because Hamilton County has 4 health jurisdictions, and then obviously if you cross over the county line, it's a completely different county. We are happy to forward those on, so feel free to not spend much time researching the correct health department. We'll take care of getting it to the right jurisdiction for follow-up.
And I know in previous briefings you said that you don't have a crystal ball, and I know you don't want to get out in front of the state, but I saw on Facebook last night where one county has already canceled their county fair for the summer. And a lot of people are asking me, what about large events? When are we going to know? We're talking, community events, concerts, county fairs. Should people plan on there not being any of those type events this summer and fall?
That's a really difficult question. I had the privilege of talking with the Harvest Home Fair on the west side. They're one of their organizers, and I offered the same advice that you just referenced. I do not have a crystal ball, but the reality is some of these events are planning. There is a large upfront cost that has to happen, and sometimes in that scenario, the risk is too great to put that much money out for the possibility of a cancellation. We know that when you pack a lot of people into a tight area, that the spread of COVID-19 is greatest. And for that reason, the mass gatherings will be probably one of the last things to come back. So while I can't predict what August will look like here in Hamilton County, I do think that organizers need to take all of these things into consideration as they're planning.
Thank you.
Did Harvest Home say they're going to cancel? They did. Yeah, so just to be clear on that one, unfortunately, I think Pete Rebold is the gentleman that has been in charge of Harvest Home, and I do believe they've come out and said they are going to cancel for this year. I want to remind people that we and Greg have to follow the guidance from public health at the state level. And so while Greg can be stricter than that guidance, he cannot be more lenient than that guidance. And so Greg does not have the authority to say to Price Hill Chili or anybody else, you can open up tomorrow, because the state guidance doesn't allow for it. So I just want to be clear on that point, because I think sometimes Greg takes a bit of heat for decisions that are being made elsewhere. So again, he could be more strict, but he cannot be more lenient. So we're all trying to work collectively with the state to, and I think it's important to note that all these jurisdictions are under the purview of the state. So we're all under the same guidelines. And so I think that's just an important thing to remember. Bridget?
Thank you, Commissioner. Our next question is from Scott Wortman with the Inquirer for you, Commissioner.
Morning. With the businesses starting to reopen, there'll probably be more complaints, much like when the stay-at-home orders first went into place. How much more prepared are you now compared to then, and how will your response be different?
The good news is we are definitely more prepared. We've got a database set up so we can better track which complaints are coming in. That actually is in part because of some questions that you were asking early on, so thank you for those. I do have the same team ready to go, and that same team has a lot of experience, obviously a couple months now, of managing these type of questions. Our call volume luckily has dropped significantly, and so if we do see a spike here in the coming weeks, we are ready to handle that.
And the commissioner talked about the additional county staff that is doing contact tracing. How many more people have been brought on for that? Do you have a specific number?
I believe initially we are utilizing about 20 county staff from various departments. And then we're going to feel as we go how much more we need to bring on. You know, we're kind of entering into new territory. We want to make sure we're prepared. As I've shared here during these briefings, well over 1/3 of my staff are trained to do this work. But as Ohio opens back up, a lot of my staff I'm trying to reutilize to do some of their normal work as well. But I do have the capacity to bring them back in if I need to. So it's a balancing act to make sure that we're serving the public with everything we can.
What right now is the threshold for determining who is worthy of follow-up as far as what contacts of a COVID-19 patient do you have to contact, and how long on average is each individual case?
So generally the average number of people, this is very average, if somebody is positive with COVID-19, that would result in a health district follow-up. About 20 individuals ultimately get turned into a close contact on average. So that means with each positive case, there are at least 21 phone calls that have to happen from our team. And some of those calls are easy, especially now as people know what quarantining is and are more familiar with COVID-19. But there are a lot of questions that people have when this happens. So each individual is considered a close contact if they were around the sick person within 48 hours of them becoming symptomatic. Throughout that period, if they were within 6 feet, they would be considered a close contact.
All right. Thank you.
Question for you, Commissioner Kesterman from Jay Hanselman with WVXU.
And I think you sort of answered that there but I want to clarify. When you say close contact, what kind of timing are we talking about? Are we talking about if I pass somebody in the hallway, or does it need to be prolonged? What is close contact?
You know, typically if you're within 6 feet for a minute or two, we are considering you as a close contact. The 48 hours from the last symptom, that has changed throughout this pandemic. We do everything based on the state of Ohio guidance as well as the Centers for Disease Control. Early on in this pandemic, it was anytime you were around someone when they were symptomatic. It shifted to the same day they were symptomatic, and about 2 or 3 weeks ago, it shifted within 48 hours of symptom onset.
Okay, that appears to conclude our questions from reporters.
Thank you.
Thank you to Greg, as always, for being here. It's always so informative, Greg, when you brief us on the situation and answer the questions. So again, I'm going to repeat that on Monday, Jeff Aludo will be here. He's the county administrator, and we'll be talking about the strategies that the county is going to employ to start to open up some of the buildings, start to open up some of the services that would be available by way of the county. It's going to be, I'll tell you this, it's going to be a slow open because we don't want to mess this up, right? We want to get it right so that we don't find ourselves having to close things down again. That is just not a good scenario, and I think most of us are in that boat. So we'll be back on Monday. I don't know if y'all can see that Jay is sweating like crazy back here because it's been a big news day. There was a lot to report. So, Jay, thank you again for hanging in there with us. Man, he's struggling today. There's a lot going on. So, thank you all. Have a good weekend. We'll see you on Monday.